Hi, I'm Laurie Thomas, VP of Strategic Development, and I'm here with Phil Fogg, President and CEO of Marquee Companies and Consonus Healthcare. 2019 is going to be a year unlike any other in our profession's history, and we will absolutely change the way we do business. No one's going to be unaffected. Is that fair to say, Phil?
Very fair to say, and I would tell you that since 2010, with the passing of the Affordable Care Act, all we've done is manage change, but now we're going to get one of the most sweeping payment changes that we've ever seen since probably 1998 when RUGS was first implemented.
So the purpose here today is to give you a critical overview of what we're facing in the new year and offer some essential strategies and tools to help you survive. But before we get started, let me tell you a few things about Phil. Besides leading Consonus and Marquee in providing senior care, rehab, and pharmacy services nationwide, he serves on the American Healthcare Association's Board of Governors, as well as several other healthcare-related boards that support our industry. Can you talk a little bit about what you think is going to be happening in 2019?
Our long-term and post-acute care sector has really seen a decline in margins, and you're looking at an environment where there's a lot of financial pressures. And in the midst of that, all of a sudden you're going to see a reimbursement change that could stress providers beyond the breaking point. So it could be a really challenging year.
Okay. Let's drill a little bit into specifics. As a provider, what do you think are the most pressing things that a provider needs to be paying attention to? What are the driving factors that they need to be focused on?
Yeah, this transition in PDPM is got to be the main focus for all the providers. If they don't manage that properly, it could be the tipping point. And in order to do that, they're going to really need to be able to begin managing the levers of the patient-driven payment model today, not waiting until October 1st. It could be too late if they do that. And so, at Consonus, we've developed tools. Our data analytics solution that we call Copilot, we've created a tool within that enables providers to crosswalk their RUGS payment patients today to what those would equate to in a PDPM model. And I think that's going to be critical. I think you're also going to need to have a rehab provider who's going to be able to adapt to that new system, and they're going to need to be able to get the highest functional improvement or outcomes with the least amount of rehab minutes or the most efficient use of rehab minutes.
Let's talk a little bit about managed care, because as we know, we're in kind of the hotbed of managed care and have a great deal of our patients that have a managed care plan. How do you think we can impact that?
Yeah, managed care and specifically Medicare Advantage plans are growing dramatically. In the Western United States, we're seeing over 60% of our short-term stay population have a Medicare Advantage payer as opposed to being straight Medicare. And there's a couple of things that can cause. One is the Medicare Advantage plans have negotiating power over the providers in most environments. And so as they become the majority payer, if they're not covering our costs, it can be very damaging to the economics. And so first and foremost, you need to have partners like Consonus who have the experience to be able to guide you through the process of negotiating with your managed care payer. Mm-hmm. The other thing is that you need to be able to have the analytics to be able to demonstrate to that payer what your value is, and you need to be able to compare that to your competitors so you can differentiate yourself.
As we move towards episodic payments, providers are going to have to manage their two biggest costs, pharmacy and rehab, and that's no small task. Yeah. And they still have to protect the patient experience. So what kinds of things do you think we need to be prepared for with these alternative payment models?
Well, I think I'm going to talk about two of the alternative payment models. The first would be the hospital readmission value-based payment. Mm-hmm. That got affected on October 1st of 2018. Mm-hmm. It is shocking to me that most providers aren't even aware that they may have received a reduction or an increase. And part of that was because they got a COLA increase from Medicare of 2.4%. So if they got a reduction, if they lost the whole 2% of that value-based payment, they may not have known it because the net of that they thought was an increase. So the first value-based payment and alternative payment model I would talk about is the need to be able to manage that hospital readmission rate and continue to do so. The second matter for this coming year is really going to be bundles. I thought that the bundle issue was going to be mitigated as long as there was a Republican in the White House.
Right.
However, and I also thought that as soon as a Democrat came back into the White House that we'd be dealing with bundles again. The hospital health systems taking incentive payments for reducing expenditures in post-acute care is clearly a challenge for our sector and our profession, and we need to be able to manage that. Now, recently, Secretary Azar announced that they are reinstating the bundles, and not only that, but SNFs got excluded from Model 3 bundles.
Wow.
And so there's a lot of challenges there. As a provider, over the next year, you need to know your hospital partners. You need to know if they're in the bundled payment program, and you need to know what DRGs that they are taking risk on. And beyond that, you then need to be able to go to that partner, build relationships with them, and be able to demonstrate to them that you're going to have lower utilization, lower hospital readmissions, lower overall cost, so that they want to partner with you.
So what part does rehab and pharmacy and the use of data play into this?
Yeah, the data is just critical because the hospital health systems are really looking at the CMS information, and it can be 6 to 9 months old, and you need to be able to take real-time information on how your hospital readmission trends are going, and you need to be able to go further to some of the root cause analysis of, is the hospital readmission occurring in a 30-day period in your skilled nursing facility environment, or is it upon discharge? And maybe it's a home health provider that you don't have any control over who's causing that readmission. So that's part one. Part two is you've got to have a therapy team that is going to be able to, again, treat residents and have them on discharge, be able to have the tools and the functional ability to be able to go back into a community environment and not go back to the hospital.
So that speaks a little bit to the rehab impact. What about pharmacy and how it plays into this whole alternative payment model?
You know, pharmacy for years has been ignored in terms of what their impact is. And we're working on some very exciting things for 2019. We're working on integrations between the hospital and our clinical pharmacy consultants to be able to do drug regimen reviews prior to admission, so that when that person comes into the facility, we can not only have the right drugs to them on the day of admission, but we can reduce the cost to the skilled nursing facility provider. We estimate there's 30 to 35% of the drugs that get changed after admission, because you've got a hospitalist who's making the discharge orders that doesn't understand a post-acute care environment. Right. And so we're really excited about it. We think that that's going to really enhance our clinical outcomes, and I think we're going to be able to reduce the hospital readmissions from the skilled facility as well.
So Phil, let's talk a little bit about upcoming survey and regulatory changes.
Yeah, the first thing I'd say, I don't think anyone would disagree that the 5-star system is really here to stay. Yeah. So we now have to be a part of evolving that into something that we think is credible and accurate. The public makes decisions off of the 5-star system. Payers make decisions off the 5-star system, and so it's here. Now, the requirements of participation in our survey process, we're going into phase 3 of that. There are some burdensome requirements on that. People will have to implement that in 2019. The American Healthcare Association has been pushing very hard for reform to that third phase. Mm-hmm. I think they're going to be successful. In fact, there is currently changes in the rules that are being scored on the Hill, and I hope to hear soon that some of the burdensome, costly parts of that rule will not be affected.
Okay. What do you think a partnership with Consonus can do to help with these changes?
How you comply and the results that you get in quality measures is a comprehensive effort. It's not only the clinicians that the nurses and team members in a facility, but it's rehab, it's pharmacy consultants, it's the pharmacy nurse consultants. Right. And often people think about pharmacy as just give me the drugs.
Right.
And they don't think about the value of the pharmacy partner in terms of what they can do, not only to help their clinical outcomes, improve their quality measures, and not just antipsychotics. All of their quality measures can be taken back to their medication therapies.
Right.
And I think it takes all of these clinicians working together to maximize not only the regulatory results, but also all of the pay-for-performance results.
Do you see any specific application for the Consonus Copilot data analytic tool with all these changes?
Well, absolutely. Not only does our Copilot solution enable a provider to articulate their results to payers and to hospital health systems, but we've had a recent enhancement that enables providers to be able to get real-time survey information. So if you're sitting in a facility in a county, you can see what all of the recent surveys in your market area have had in terms of the FTAGs. And so you can get a real sense for what the focus of the survey teams are. That is critical, valuable information if you're prepping, and it can really help you to where you want to focus.
Yeah, my understanding is that's actually pretty close to real time, so you're not using the dated information that's available once it becomes available.
Yes, very correct, yeah.
When you think about all of that we've talked about today, before we leave, what is the main takeaway that you'd want providers to know?
Yeah, I think that the marketplace is going to continue to segment into winners and losers. And you can see it when you look at some of the economic studies of what the sector is doing today. You've got a 25% of the marketplace has margins of 4.5% plus, but there's a bottom 25% quartile that's losing money.
Right.
And in order to be able to survive and thrive in this future, you've got to do more than one thing. You've got to do several things. It's maximize all of your pay for performance measures like hospital readmissions and your 5-star and your functional improvement scoring and your core Q customer satisfaction questionnaires. You've got to be able to develop your workforce. It's absolutely critical. You've got to be able to capture and maintain market share. You've got to be able to continue to invest in your real estate and your facility environment in order to be able to have a product that the marketplace wants. And then, just managing your leverage position. So many providers have gotten over leveraged in the last 4 or 5 years, and that just reduces the margin of error as we get all these driving forces impacting us at one time. So I think big picture message is you need to try to be a winner in the next 4 to 5 years, because it's going to be tough. And but if you can get through those 4 to 5 years, I think you're going to be here probably for the next 15 to 20.
Right. And interlaced through our conversation today, you've talked about the importance of having partners that understand this.
Yeah, I think that that providers need to really think about their business partners, whether it's pharmacy, rehab, data analytics, any of their business partners. Many providers will define value as the cost per unit, the cost per minute, the cost per their generic drug. And you have to really ask yourself, is that really the true value? I mean, at the end of the day, value is created by the NOI and EBITDA that you generate in your facilities, and cost is not always the driver of that. Customer experience, the ability to get those quality results, the ability to manage your hospital readmissions, the pharmacy, rehab, data analytics have huge impacts in those areas, and you're going to miss a lot of value opportunity if you just focus on a cost per minute.
So, did we miss anything else? Is there anything else you'd want our audience to know?
Yeah, I got to take it back to PDPM. I would tell you that there are providers that, once again, are kind of overreacting or panicking right now, and they think that the way they're going to adapt to PDPM is just by lowering their cost of rehab, cost of pharmacy, cost of everything.
Right.
And if they do that at the expense of having partners that are going to help them successfully navigate through and be able to capture the full value, the true value of the people that they're serving, they are going to lose in that scenario, I guarantee you.
Thanks, Phil. We've talked about a lot of these challenges, and we know that many of you are facing uncertainties. So whether you're an existing Consonus client or you're a new customer looking for help, just remember you're not alone. We've led the industry in successfully navigating these changes for many years, and we'll get through this together.
Laurie, I just would add that, over the last 30 years, we've gotten through a lot of sweeping changes that have threatened our profession. And I hate to say it, but we almost get excited when there's transition and change because we feel like we can thrive through that. And I just would want everyone seeing this to just know that as a Consonus customer, we feel it's our responsibility to help our customers navigate through that. If people don't get through it successfully, we feel like we failed. And so we take ownership for it and we invest in their success.
For more information about how a Consonus partnership can help you survive in this rapidly changing environment, we encourage you to reach out to us or find us on the web.